next fertility awareness method I want to talk about is the cervical mucus method. This involves tracking the changes in your cervical mucus. As women, we realize that depending on the time of our cycle, our vaginal discharge changes. The color may change, the texture may change, the consistency may change. We realize that sometimes it can be thick, it can be very slimy or slippery, it can be very light, it can be yellowish or whitish. So all these are affected by hormones in our body. And these hormones cause the cervical changes, the cervical discharge changes. And when that happens, it informs us as to whether we are fertile at that time or not. One thing I would like to say is that to be able to use the cervical mucus method, you need to chart at least 2 months before you can tell that around this period I'm most fertile, around this period I'm not fertile. And then the couple would abstain from sex during the fertile period, or will use a backup method such as a condom, such as spermicides. And then when she's not fertile, they can have sex freely without any form of contraception or protection. How do you do it? Before you pee, let's say you go to the bathroom, before you pee, you can just pass your hand into your vagina and then feel for the discharge. You check the color, you feel for the consistency, and then you feel for the texture. Immediately after your menses, that is a couple of days after your menses, let's say about 5 days or so after your menses, if you check during your menses, because of the blood and all that, you may not be able to know the texture of it. But after your menses ends, you can start checking it from that time. Immediately after, you realize that the discharge is a little thick and it's not slippery, it's not slimy. If you test it, you check it in between your fingers, you realize that it's not slimy, it's just very thick and sometimes maybe whitish. This means that you're not fertile around this period. You check it, you chart, or you write what you find on it. As the days go by, you realize that the discharge gets lighter, it gets more slimy, it gets more slippery. And then just before ovulation, the discharge becomes a lot. And then it's very slimy, or it's, should I say it's like okra. So when you check it in between your fingers, you're able to stretch it to a long distance between your fingers. We call it spin back height. So when it is as stretchy as that is when you are most fertile. So for that period, it's advisable not to have sex, or if you want to, you would have to use a backup method like a condom or spermicides. And then after about 2 or 3 days after your ovulation, you realize that it goes back to its non-slippery state. The discharge will reduce and then it becomes thick again just before your menses. Then the whole cycle starts all over again. So if you're able to chart all these changes in your cervical mucus for at least 2 months, you would know that just when I'm about to ovulate, my cervical discharge becomes more slippery or more slimy. So I'm not going to have sex at that time. I would abstain or use a backup method. And then after the sliminess goes away, when it becomes thick again, you know that you are not fertile. So you have sex around this period. And then you would prevent yourself from getting pregnant. If practiced very well, it is effective. Next one I'll talk about is the temperature method, or the basal body temperature method. It's also the same thing. You avoid sex around the time that you are ovulating or around the time that you are most fertile. How do you do this? You take a chart. You check your temperature every day at a specific time. So let's say you wake up at 5 a.m. Before you get up to go and brush your teeth, talk to somebody, think about the problems of Ghana, you check your temperature. And it has to be at a specific time, at a specific location of your body. If you're going to use your oral temperature check, you have to use oral temperature check for the whole time. If you're going to use your rectal temperature check, you have to use a rectal temperature check for the whole time. If it's at 5 a.m., it has to be at 5 a.m. for all the readings. So naturally or normally, the normal body temperature before ovulation is between 35.5 and then 36.6. After ovulation, it goes up a little, between 36.1 and 37.2. So if you're able to chart this every day for the cycle, you need to track it for about 3 months so that you can rely on it. If you're able to chart it for the 3 months, then you realize that, okay, around this time, my temperature goes up. So if it stays at that time for, let's say, 4 or 5 days, then you know that I'm not fertile at that time. That's after ovulation. But before ovulation, you would realize that your temperature is a little lower. So when that happens, then the woman, you avoid sex around this time so that you do not get pregnant.